Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
I want to thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 36,484 confirmed cases, 938 new cases reported today, 739 people in the hospital, and sadly, 1,006 people who have died. As we officially cross the 1,000 deaths mark, we continue to pray for those we've lost and for their families. Today marks our highest day of people hospitalized for COVID-19 since the pandemic began. Over the weekend, we saw our single highest day of new cases reported. We're seeing more viral spread, and these numbers are concerning. In fact, Dr. Deborah Birx of the White House Coronavirus Task Force contacted Dr. Cohen on Friday with her concerns. Now, with all the challenges we face opening schools, boosting our economy, and tackling racism head-on, we must remember that this virus is still out there and can be deadly. In our jobs, in our protests, in our recreations, and in our everyday lives, we must protect ourselves, our families, and the people around us. If you have been in any kind of crowd, please go get tested. When you're around people, wear your masks and try to keep 6 feet away from others. Especially if you are a leader, set a good example. Sports figures, entertainers, civil rights leaders, preachers, CEOs, legislators, all should demonstrate that wearing a mask and standing apart is a sign of strength and caring. We wear these at the Emergency Operations Center while we are here. Your followers are watching you, and their lives may depend on your example. Slowing the spread of this virus is especially important as we work toward one of the most important dates on our calendars, reopening schools to in-person instruction. Nearly 3 months ago, on March the 14th, we made the difficult but necessary decision to close K-12 public schools for in-person instruction. It was a tough call because we knew then, and we know today, the hardship caused not only to the students and teachers, but to the families as well. Remote learning is difficult for many students and their parents. Schools are vital to learning, physical fitness, and social interaction. And for many students, it's also a place for healthy meals, safe environments, stability, and routine. Today, as we mark the last week of the traditional school year, we are pushing forward to get schools open again this fall. Staff from the Department of Health and Human Services, the Department of Public Instruction, and the State Board of Education, along with education leaders across the state, are working together on a plan for reopening the school buildings for the next school year. We want schools to be open in a safe way so our children can get back into the classroom. Today, we're releasing the health guidance for schools to reopen their doors for students. This health guidance will be accompanied by operational guidance from the Department of Public Instruction. One important note is that opening schools will depend on our health metrics. We very much want to open the school buildings, but we won't open them and make a reckless decision when it's so important. We know this coming school year will be like no other. Students and staff will be screened for illness before they enter the school. Children will be asked to stay distant from classmates. They won't be sharing pencils or textbooks, and there will be a lot of cleaning. We'll all need patience as the plans for each school come together in the coming months. This guidance is an important first step, and now the hard work will be done by local school boards, superintendents, principals, and school nurses to tailor the plans for their particular schools. I'd like to thank the Department of Health and Human Services, staff, and our education leaders for their work to this point. Superintendent Mark Johnson and State Board Chair Eric Davis are here to discuss the next steps. In recent weeks, much attention has been paid to the current Phase 2 and what's allowed to be open. We are weighing carefully these decisions, but we're concerned that a number of our virus metrics are trending upward. Our important mission of opening school buildings on time could be affected by the failure to slow the spread. We do not want that to happen. If we're careless now, if we ignore the 3 W's, if we violate mass gathering rules, we don't just risk our own health. We risk the ability to get our students back in the classroom, learning in person with their teachers, socializing safely with their friends, getting back to a routine. I know this virus has created hardship and challenges for students, their families, our educators, and school employees. But I've seen those teacher parades, the school cafeteria workers going the extra mile, the socially distanced birthday celebrations with friends. These not only boost spirits, but they also remind us of our resiliency. As we remain laser focused on getting kids back into school safely, we have to tap into that resiliency. Let's lead by example and do everything we can to create safe, healthy environments in the school buildings that we all miss so much. With me today, our Secretary of Health and Human Services, Dr. Mandy Cohen, our Superintendent of Public Instruction, Mark Johnson, State Board of Education Chairman, Eric Davis, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Nicole Fox are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now hear first from Dr. Cohen. Dr. Cohen?
Thank you, Governor. Our children are our future leaders. They're our workers and problem solvers. North Carolina's health and economic well-being will be shaped by how well we prepare them for those roles. We know schools are more than buildings, and how we move forward has immediate and long-term consequences. We want to be able to open schools for in-person learning for the next academic year, but we're going to have to work together to make that happen. As the governor said on Saturday, we reported our highest number of new laboratory-confirmed cases in one day, at 1,370 new cases. At the same time, our other key metrics have moved in the wrong direction. COVID-19 hospitalizations are increasing and stand at 739 statewide, and our percent of tests that are positive is now among the highest in the nation. I am concerned. These trends moving in the wrong direction is a signal we need to take very seriously. One of the drivers of this increase is more movement. As you may recall, we've shared that it takes about 2 weeks to see the impact of a change in policy on an outbreak from an event. And that's because of that incubation period from the virus, meaning the time from when a person was first exposed to COVID-19 to when they become sick. It's about 14 days. And that's important because if you remember, about 2 weeks ago on May 22nd, we moved into phase 2. We will need to come together and each do our part to change the trends of these numbers. It's going the wrong way, and we want to get our kids back to school. First, each one of us needs to follow the 3 W's. Wear a face covering, wait 6 feet apart, wash your hands. These are easy actions that have outsized impact, but we all have to do them and do it consistently, every day, every time. Second, if you have symptoms or think you've been exposed to COVID-19, get tested, even if you don't have symptoms. If you attended a mass gathering or a protest, get tested. If you work in a setting at higher risk of exposure, like a grocery store or a child care program or a restaurant, get tested. If you work in a high-risk setting like a food processing facility, get tested. It's easy to find testing sites on our website with our Find My Testing Place tool. The third thing we're all going to need to do is answer the call. Our local health department staff and other COVID-19 community team members are going to be reaching out to people who may have recently come into close contact with someone who tests positive for COVID-19. This team will connect them with important information and support needed to protect themselves and their loved ones. So answer that call. Finally, if you have COVID-19 or been exposed to it, stay home and avoid other people in your household. Opening schools and finding a way to get back to the things we love as safely as possible is a possibility. Together, we can protect our loved ones and neighbors and slow the spread of COVID-19. Thank you.
Thank you, Dr. Cohen. We'll now hear from our Superintendent of Public Instruction, Mark Johnson. Mark?
Thank you, Governor, and thank you to your team that has been working closely with the North Carolina Education Agency with the shared focus to return to school as safely as possible this fall. Today, North Carolinians have the important first step of returning to school with this release of the final health guidance for schools from the NC Department of Health and Human Services. We are grateful that if our state metrics are positive, local school districts will be able to take steps to safely return students to classrooms, while also ensuring schools can accommodate students and teachers who may have health concerns. If, however, our great state takes a turn for the worse, all schools will follow more stringent guidance from our state's health experts on how to best ensure the safety of our students, educators, and communities. Under either of these scenarios, all public schools will have the support of North Carolina's Education Agency here in Raleigh. We have already been leading work groups to create draft operational strategies that will help our school systems prepare for the fall. These groups are comprised of diverse stakeholders, from teachers to school staff to superintendents and to other support professionals. With these final health guidelines in place, we will now seek even more feedback on those draft operational strategies from other stakeholders, such as more local superintendents, the school's reopening task force, and other advisors, in order to ensure that we best capture the needs of all of our schools across our entire state. I want to thank Governor Cooper and the General Assembly for working together to distribute the federal relief funds to our schools and help ensure that we help our students get a great start to next school year and to improve learning opportunities that may take place outside of the classroom if, heaven forbid, we are faced with another spike of COVID-19. Importantly, thank you to all the students, all the educators, and all the parents across North Carolina. Our state has made very difficult sacrifices to confront this unprecedented crisis. This virus has threatened our health, our economy, and even our way of life. We should strive to get students and teachers back into classrooms in the fall, especially our younger students, like my daughter, who now has to finish her last week as a first grader with remote learning. There is no replacement for time spent in the classroom. But also know that as education and health leaders, we are balancing the need to get back into the classroom with the reality that COVID-19 is still out there. Just last week, North Carolina lost a young student to this horrible virus. And our top priority must be to prevent any families from having to go through the horrible pain of such a loss.
Thank you, Mr. Superintendent. We'll now hear from our State Board of Education Chairman, Eric Davis. Eric?
On behalf of my colleagues on the State Board, every member of the North Carolina education team, and our nearly 1.6 million public school students that we serve each day, I express our gratitude to you, Governor Cooper, for your steadfast leadership during these most challenging times. And to Secretary Cohen and her outstanding Health and Human Services team, we extend our appreciation for your leadership, expertise, and partnership. While we on the education team across North Carolina have a variety of opinions on what should be required or recommended, consistent or flexible, you and your team sought out our varying opinions. You listened to each one and you took steps to address them, all while keeping the health and safety of our students, their families, and our education team paramount in your decisions. You and your team are a model for how we need our government to perform, especially in times of crisis. When combined with the operational and academic instruction guidance being finalized under the leadership of Drs. David Stegall and Beverly Emery with the Department of Public Instruction, our local education leaders will have the consistent statewide guidance, which with their own expertise and skill will provide for a successful return to our school for our students in August. While this health guidance will come before my colleagues on the State Board for their consideration on Thursday, as one member of the board, I have full faith and confidence in this health plan. I'm certain that if vigorously implemented, along with the DPI operational plan, we will provide a safe, secure, and welcoming environment so that our students can once again be with their classmates and enable our extraordinary teachers, nurses, counselors, and all support staff to do what they do best, caring for and educating our students so that they can achieve their goals and graduate to become adults who make North Carolina an even better place. As this pandemic continues to evolve, I am confident that our partnership with the Department of Health and Human Services and the Governor's Office will enable our statewide education team to effectively respond in a flexible way to our students' needs. Even as we bring this current school year to a close, we look forward to the coming year with great anticipation. Rest assured, we are determined to open and operate our schools in the coming year, and will do so consistent with the best thinking of our public health partners. The safety and health of your child, your child's teacher, and every member of our education team, in our eyes, demands nothing less. Thank you.
Thank you, Mr. Chairman. We'll now open the floor for questions for any of the people who spoke or for Eric Hooks or Mike Sprayberry. And we'll start with the first question and ask you to identify yourself and your organization.
Our first question will be from Gary Robertson with the Associated Press.
Hello, Governor. I wanted to talk to you about the RNC, and you probably have seen some news reports about legislators looking to introduce legislation that would basically allow the convention to hold gatherings at full capacity within the Spectrum Arena. Of course, there'd be some other safety restrictions, but what are your thoughts about the legislature in trying to intervene in this matter between you and the Republicans?
Well, this is between the state of North Carolina, the city of Charlotte, and the RNC. And they had been working on a plan that would provide for a scaled-down, safe convention until right around Memorial Day, when there was a demand of a guarantee of a full arena, 19,000 people, and that we had to guarantee it by the end of August. We said, we want to work with you on a scaled-down convention, but we cannot guarantee a full arena at the end of August. It looks like, and I haven't read the legislation, but from what I hear about it, it looks like that the legislature wants to step in and guarantee that happening. That's irresponsible. And what we need to do is to continue our conversations with the RNC, but understand that the public health and safety of North Carolinians and everybody at that convention should come first. Thanks. Next question.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, it's Dawn Vaughn with the News and Observer. Two different questions. Governor, at the beginning you'd mentioned that Dr. Birx had called Dr. Cohen, so I wanted to find out about that conversation. And then also, you have talked about the reopening schools guidance. I haven't said any details yet. What is it generally, and is any of that a requirement, not just guidance?
In talking to our health experts this weekend, they're concerned about having our highest number of hospitalizations. They're concerned about the increasing number of positives and our increasing percentage of positives. These are numbers that we don't want to see. It's my understanding that Dr. Birx did call Dr. Cohen, that the White House Coronavirus Task Force had noticed those numbers. These the guidance for schools is about ways that they can make sure that they can keep students and teachers healthy. But what I'll do is let Dr. Cohen address both of those issues, and then if one of our education leaders wants to come in and talk a little bit about specifically the health guidance for schools, we can. Dr. Cohen?
Thank you, Governor. And yes, first let me address, yes, we got a call from Dr. Birx on Friday, and I was very appreciative of that call because she is looking at the data that we are also looking at and the trends moving, as the governor said, in the wrong direction. And all of us want to make sure we're staying ahead as much as we possibly can of this virus. And so we had a good conversation. She was sharing how they are tracking data, and she has a different ability to look at things beyond North Carolina. Obviously, from her perch at the White House, she can look across nationally, and she was sharing with us her concerns about North Carolina's accelerating trends in the wrong direction, which is why we need to be incredibly vigilant in our actions, and we also need to make sure that we are, as I was sharing in my remarks, ramping up testing. We are seeing that the virus is spreading more, so we want to be doing testing, working very closely with our partners in local health departments to make sure we're doing the tracing that we need. But we have a lot of work to do, and as we're here today, we want to be sure we're keeping opening of schools as that top priority. We want to get kids back to in-person learning. And so to address your second question about what is required versus recommended, yes, there are minimum requirements that are included in these guidance. We did a lot of stakeholder work with superintendents and our education partners, and appreciative of the work. As Chairman Davis mentioned, there is a lot of discussion, but while we always kept the health and safety of our students and teachers at the core of what we were doing. So there are core requirements, things like screening when kids are going to be arriving at school, making sure that we are checking for symptoms, things like some of the additional social distancing and hand washing. But then there will be other things that are recommendations. Now, we would like folks to be following as many of those as possible, but we did want to make sure that there was flexibility to make sure we were tailoring things to individual schools' needs. So now we'll have these guidance. I know Department of Public Instruction is working on how to operationalize those, and I think those things together will work to help all of our school districts be able to move forward, so our kids will be able to return to in-person instruction, but do it in a way that protects their health overall. Thank you.
And thank you. I'll just reemphasize that from the beginning, the health guidance has come from the health experts, and that is what schools will continue to follow, the health guidance from health experts. I believe the plan is going to be made public at this time, and I know that there are different plans based on what the metrics are. And along with the health experts, we very much hope that we continue to see improvements and not negative trends. Under the health guidelines, improvements would allow for more flexibility for districts. Negative trends would shut some of those down into requirements when it comes to social distancing. And that is where, at the Department of Public Instruction, we are working very closely with the health experts to help bring operational guidance. There are large school districts who have already started planning for what social distancing would look like in school, on a school bus, in a classroom. But there are also a lot of small districts in North Carolina, in rural North Carolina, that will definitely be looking to the Department of Public Instruction for help and guidance on those operational strategies, and we're going to stand ready to help them.
Yes, just to add a little more context to it, I think the beauty of this plan is, as the superintendent mentioned, it accounts for a variety of situations that we need to be prepared to respond to. From our current operating model, which is completely remote instruction and no in-person, to our most desired, which is students are back in our schools in front of their teachers doing a lot of cleaning, but basically back as close as we can get to the pre-COVID state. And then in the middle, a plan that would account for the need to spread our children out, have fewer children in our schools in order to ensure their safety, but still be able to have as many in our buildings as possible at any one time. We anticipate that once the decision is made, we'll know which plan to operate under, but we anticipate during the course of the year it might be possible for us to move between plans as the situation with the virus continues to evolve. I can't emphasize enough that the most important thing each one of us can do to get us to that most desired operating plan is to follow the public health guidelines. If each of us individually do that, we'll have a positive effect on the virus and have the best opportunity for getting to that most desired state of all of our children in our schools. Thank you.
Thanks. Next question, please.
Our next question will be from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. I'm sure you, and busy your day has been, received information from Senator Gunn in terms of the gyms and the bars and restaurants bills. And I just wanted to see if you've had any kind of preliminary or initial response to what he suggested in terms of lifting some of the restrictions, but also allowing the Council of States to have oversight over or concurrence over your decision.
Well, I'd rather open schools than bars, and we need to keep our focus on doing things to get our numbers in such a position that we can open schools. When we saw things start getting better back in March is when we closed schools. and things started slowing down, and we started doing much better with the virus. So that we know that when we open schools, that people are going to start moving more and being together more, and we have a chance to drive our numbers up. We're still considering a phase 2.5 and are looking at the potential of providing more opening for more businesses. I think legislation is the wrong way to do it because it makes it more difficult to make the decision to go backward. It makes it more difficult for local governments to be able to make decisions there. So we have concerns about that legislation. We look forward to continuing to talk to the health experts and everybody in those industries so that when we do get to a point where we can do more helping the economy by allowing businesses to do more things, then we can make sure that we're doing it in the way that will be optimal to them and to the safety of their customers. Thanks. Next question, please.
Our next question will be from Tina Terry with WSOC.
Hi there, this is Tina Terry with WSOC TV in Charlotte. You kind of addressed the question that I had a moment ago. I will just ask for a follow-up. One of the authors of the bill that would allow both bars and gyms to reopen talked a little bit about adding a fail-safe that would allow the governor to go back in and reclose those businesses if needed. With those changes, would you be more willing to consider signing this bill into law?
Well, we're relying on health data in order to make decisions about opening more businesses and creating more activity out there where people can move around. I know that the health experts are working with people who represent bars and people who represent gyms about the potential of allowing them to do more, but we've got to keep our numbers in mind and we've got to make sure that we are being safe. And right now our numbers are not going in the right direction, and we want everybody to begin the process of doubling down on taking protections and making sure that they get tested so that we can isolate people and slow the spread of the virus. Yes, I'm willing to work with legislators on all of these issues. I have been in discussions with them, but when they pass legislation and put things into law, it slows the process down for decisions that sometimes need to be made quickly. And we'll continue that conversation, but it's most important to protect the health and safety of North Carolinians while we try to make sure we boost our economy. And we're working on that delicate balance. These decisions can be very difficult, but we know that health and safety of the people of our state has to come first. Thanks. Next question, please.
Our next question is from Dewan Hogard with ABC 11.
Good afternoon, Governor. Quick question about the Alamance County Speedway. They held the race over the weekend. Some 2,000 people attended. However, they held this race under the guise of fighting injustice and inequality, saying they were holding it in protest. Is there any sort of protest loophole for mass gatherings as we have seen? Do you have any reaction to that?
People shouldn't run a money-making operation that puts in danger not only their customers, but anybody who would come into contact with their customers. This is a reckless decision being made by the owners, pulling people together in that way that can cause spread of the virus. Alamance County is one of the counties that is having higher numbers than it should have, and we look forward to taking some action on this in the coming week. It's concerning that Alamance officials have not been able to stop this. We would hope that they could, but if they can't, then the state will have to take action, which we will do this week if the local officials don't. Next question.
Our next question will be from Travis Fain with WRAL.
Yes, thank you, Travis Fain, WRAL, for Dr. Cohen. The WHO said today that asymptomatic spread is pretty rare, which is confusing. I'm wondering if that is consistent with what your teams are finding when they do contact tracing, and if so, then what is it that is driving the spread of this virus? It's kind of hard for me to imagine people in numbers who have symptoms going out in public right now.
Travis, thanks for that question, and I'll review the WHO guidance, which I have not seen. What I did review last night was a meta-analysis of many studies looking at the viral spread, and what that study showed was up to 49% of cases had asymptomatic spread. Now, some of that might be that they just haven't shown symptoms yet, so they might be pre-symptomatic, but it was basically sharing that people can have this virus and they can infect other people when they don't show any symptoms. And that's what is so hard about COVID-19. And it is why the governor and I and others continue to say we need to wear face coverings, because it is so often that people can have COVID-19 and not know it and then infect a lot of folks. And particularly as we think about mass gatherings, we are reading more and understanding more research about super spreaders. So there can be one person who may have no symptoms who can spread this virus to many, many people that might be together in one place, like at a speedway, as the governor was referring to in the last question. And then we can have lots of folks who have then been exposed, get COVID-19, and then spread it further within the community. So it's very concerning. So we need to be sure that folks are, number one, taking precautions to do the 3 W's, wearing a face covering, waiting 6 feet apart, and washing our hands. We're going to say it every day, and it's getting more and more important, and it takes leadership to do this. And I'd like to echo the governor's comments when he called upon our entertainers, our business leaders, our legislature to all be leaders in our communities to do this, because it is a culture change. This is hard. So we need to do this all together. That's the first step. And then the second is about testing and tracing. It's why in my remarks I shared that even if you're not having symptoms, but you have gone to a mass gathering or a protest, get a test. If you work in some of the higher risk settings where you see a lot of foot traffic, like a grocery store or a meat processing plant where we know folks are more close together and there's more risk factors, get proactively tested, even if you're having no symptoms. So that we are continuing on that. I will review the WHO guidelines, but we very much want to make sure that we are having folks understand that this virus does spread before people have any symptoms, and it's really important for us to work together to slow the spread of that virus. Thank you.
Next question, please.
Our next question is from Rebecca Martinez with WUNC.
Hello, Governor. It's Rebecca Martinez from WUNC. I have a question for Dr. Cohen. I'm wondering, Dr. Cohen, can you speak to the racial disparities that have been reported as far as COVID-19 infections in the state? Can you tell us whether those racial disparities in the data are statistically significant, and if so or if not, does that matter?
Thanks so much for this question, and you bring up a very crucial issue. And yes, we are seeing racial disparities in our data. We've talked about it a number of times. I encourage folks to go to our dashboard. But what we are seeing, unfortunately, that COVID-19 is disproportionately impacting our historically marginalized communities, those African Americans, our Latinx communities. The reason is that we have long-standing structural inequities, whether it's the fact that they are in jobs that are more likely to get exposed, they are more likely to be our long-term health care workers, or work in our grocery stores or others, they have more exposures. So there's a lot of reasons. They also have more underlying health conditions. We know that we have had long-standing disparities in our health status here in North Carolina. We've been working hard to try to to close that gap, and while we've made improvements, we still have a large problem. North Carolina also, unfortunately, still has a huge gap also of insured. We have a high number of people who are uninsured, and that tends to be more in our African American, our Latinx, and other historically marginalized communities. All of these factors together have shown that COVID-19 is exploiting those already existing disparities. We are working hard in our response effort to recognize that and to make sure our response reflects the fact that we need to be more connected to these communities, make sure we're getting more testing, more tracing in those communities, and we need to step up our efforts of working with all of our stakeholder partners to make sure that we can bridge this divide, because it's very significant and it matters for the entire state in terms of our overall wellness for the state of North Carolina. Thank you.
And last week we announced some efforts to try to deal with these disparities that are there and very real, putting more testing sites in our underserved communities, making sure that we have hired and recruited a diverse group of contact tracers. I think 34% of them are bilingual. This is going to be important. We also announced our task force led by our Secretary of the Department of Administration, Michelle Sanders, that are going to look at some of these underlying disparities and make recommendations of things that we can do to deal with health disparities, economic disparities, environmental disparities that we know are there and very present. Thanks. Next question.
Our next question is from Vanessa Rufus with WCNC.
Hi there. Thank you for taking my question. This is Vanessa Rufus with WCNC Charlotte, and I was calling to ask about the data. And we've mentioned, of course, how the metrics seem to be going here in the wrong direction as of late. Are there any options on the table to move back in phases if this gets out of hand, or are we basically in here in phase 2 and holding? What sort of things are being discussed right now with health officials?
We want to avoid going backward if we possibly can. We know to protect the health and safety of our state that we would if we needed to. What we think the better course here is to get more leaders involved in educating people about how important it is to wear a face covering, to wait 6 feet apart, to wash your hands frequently, and continue drilling that message in, because we have opened a lot of things. Most of our stores are open. Most of our businesses are open. Our kids are getting ready to go back into schools. Our universities and our community colleges are getting ready to open. We know that people are going to be doing more things. People are going on vacation, and North Carolina is a great tourism state, so more people will be here. So we have to do more than ever to protect ourselves, protect our families, and protect people that we come in contact with. We really want to open schools, but we know that these numbers are trending in the wrong direction, and we have to all come together to try to reverse this trend. So proud of the people of North Carolina. We avoided surges and spikes like other states and other countries had. And it was a very positive thing. But now we're moving up like this, and it's been a steady climb here, incline going up for a little while here. So we need to try to level this out, hopefully to go back down some, and we want people to work at it. And that's one of the purposes of coming before you today, is to urge people to work at this so that we can keep moving forward in our phases. We can get our kids in school, and we can avoid going backward. Dr. Cohen, do you want anything? Okay. Next question, please.
Our final question today will be from Michael Hyland with CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. I wanted to follow up on this call you made at the beginning for people to go out and get tested. Does that mean that literally anybody in the state at this point, regardless of what county they live in, has the ability to go out right now and get a COVID-19 test? And are you yourself planning to get a test as well, considering you're out with the protesters at one point last week? Thank you.
That's a good point. And yes, I think that we want people going out and getting tested, and particularly if you have been out in a crowd. And we've really broadened the guidelines for being able to go and get tested, and we have over 400 sites on the website where you can go and get a test. And I'll let Dr. Cohen address that as well.
Yes, thanks, Michael, for that question. So yes, we definitely want folks, particularly who may have had an exposure. So we know mass gatherings like a protest or others are places in which someone may have been exposed. And we have been saying in our guidance, anyone who has symptoms, right, so fever, cough, change in taste and smell, other symptoms, absolutely get a test. Even if you don't have symptoms, you may have been exposed and could have COVID-19. Kinds of exposures, like I said, could be mass gatherings, could be the place that you work, if it's one of the places like a grocery store or has a lot of public exposure. So we want folks to think about their own risk factors and think about testing, but err on the side of getting a test. And so what we are seeing is more viral spread in our communities, and so it is now a higher likelihood that you may have been exposed, and so we want folks to really be thinking hard about their own risk and going to get a test. That's why you can go to our website, as the governor said, to find a testing site near you. A number of those testing sites are completely free. Call your doctor to find out how to best do that, or your nurse practitioner or other clinician. So we are communicating now, particularly as we see our numbers going the wrong way, that we really want folks to really think about getting tested and talk about it with your friends and family, because they may have been exposed as well. Thank you.
Thank you all for joining us today, and stay safe, everybody. Thank you.